I want to talk to you today about something that might sound almost too simple to matter, but I promise you, it's been changing lives in ways that surprised even me. I'm talking about water, not just drinking more of it, but drinking it the right way, at the right times, with the right additions. And before you think this is going to be another lecture about guzzling 8 glasses a day, hang on, because what I'm about to share goes way deeper than that. My name is Dr. Sarah Wilson, and I've spent years working with people who have diabetes. I've seen patients do everything right, count every carb, take their medications exactly as prescribed, walk every single day, and still wake up to blood sugar numbers that make no sense. They're exhausted, frustrated, and honestly, starting to lose hope. And then we started looking at something nobody was paying attention to: hydration timing. Here's what I've noticed. When you drink water matters just as much as how much you drink, maybe even more. We've seen insulin sensitivity improve by up to 40% in some patients just by changing when and how they hydrate, not by adding another pill, not by cutting out more foods, just by being smarter about water. Now, I need to be crystal clear about something right up front. This is not a replacement for your medications. This is not me telling you to throw away your doctor's advice. This is an addition, a support system that works alongside everything else you're already doing. You keep taking your metformin, your insulin, whatever your doctor prescribed. This just helps it all work better. Let me tell you about Gerald. He's 68, retired, loves his grandkids, hates his morning blood sugar readings. He'd wake up, check his glucose, and it would be through the roof even though he hadn't eaten anything since dinner the night before. Turns out, Gerald hadn't had a single sip of water in 8 hours. His body was basically running dry all night, and when morning came, his liver was dumping glucose into his bloodstream to try to wake everything up. It's called the dawn phenomenon, and dehydration makes it so much worse. We made one change. Just one. Every morning, first thing, before coffee, before breakfast, before anything else, Gerald started drinking about 12 ounces of warm water with a tiny pinch of sea salt and a squeeze of lemon. That's it. 2 weeks later, his fasting glucose dropped 22 points. He called me almost in tears because he'd been fighting those numbers for months. So let me break down what I call the H3 method. It's built on 3 timing points and 3 essential elements. Simple enough to remember, powerful enough to make a real difference. The first timing point is morning, right when you wake up. Your body has been without water for hours. You're dehydrated whether you feel it or not. This is when your cortisol levels spike, which naturally pushes your blood sugar up. By drinking that warm water with a pinch of unrefined sea salt and some lemon juice, you're doing 3 things at once. You're rehydrating, you're calming down that cortisol response, and you're giving your body the minerals it needs to actually absorb the water properly. Aim for about 12 ounces, roughly 350 milliliters if you prefer metric. Why warm water? Because cold water makes your blood vessels constrict. Warm water keeps them open, helps everything flow better, gets that hydration where it needs to go faster. Why sea salt? Because it's not just sodium, it has trace minerals that help your cells actually hold on to the water instead of just peeing it all out. And the lemon? It gives you a little vitamin C, helps with absorption, and frankly, makes it taste better so you'll actually do it every day. The second timing point is about 15 minutes before you eat. Any meal, breakfast, lunch, dinner, drink 6 to 8 ounces of water. This is what we call preloading, and the research on this is pretty remarkable. When you drink water before a meal, it slows down how fast carbohydrates get absorbed into your bloodstream. Your post-meal glucose spike gets smoother, less dramatic. It's like putting a speed bump on that sugar highway. I had a patient named Elizabeth, 72 years old, who started doing this before breakfast. Just that one meal. Within 3 weeks, Her average morning glucose after eating went from 165 down to 128. Same breakfast, same everything else. Just added water 15 minutes before. The third timing point is during physical activity. And I don't mean you have to be running marathons. I mean walking around the block, doing yard work, anything that gets you moving for more than 20 minutes. Every 15 minutes of activity, drink about 4 ounces. That's half a cup. It keeps your blood volume stable, keeps everything circulating properly, and prevents those weird glucose swings you sometimes get during or after exercise. Now let's talk about the 3 essential elements that make this whole thing work. Element 1 is temperature. Room temperature or warm. I know a lot of people love ice water, but when you're trying to optimize hydration for blood sugar management, you want your vessels open and relaxed, not constricted. Element 2 is minerals. Use unrefined sea salt, Himalayan pink salt, something that still has all those trace elements in it. Not regular table salt that's been stripped down to just sodium chloride. Your body needs those minerals to move water into your cells instead of just through your kidneys and into the toilet. Element 3 is timing. This has to be consistent. Your body loves patterns. When you hydrate at the same times every day, your metabolism starts to anticipate it, work with it, stabilize around it. There's also a 4th timing point I recommend, especially if you're dealing with overnight glucose issues or you're not sleeping well. About an hour before bed, drink some warm water with 200 milligrams of magnesium citrate or glycinate. Magnesium helps you sleep deeper, and it helps keep your glucose more stable through the night. A lot of people with diabetes are low in magnesium anyway, so this kills 2 birds with 1 stone. Now, how much water total should you be drinking? Here's an easy formula. Take your weight in pounds and divide it by 2. That number is how many ounces of water you should aim for each day. So if you weigh 160, you want about 80 ounces. That's roughly 10 cups. Sounds like a lot, but spread it out across the day, and it's really not bad. A good visual I give people is this. Get yourself a 24-ounce water bottle. One of those reusable ones. Fill it 3 times throughout the day. Morning, afternoon, evening. Boom, you're at 72 ounces, right in the sweet spot for most people. How do you know if you're doing it right? Look at your pee. I'm serious. Pale yellow is perfect. If it's clear as water, you're drinking too much and you're probably flushing out minerals you need. If it's dark yellow or amber, you're not drinking enough. Let me tell you about Dorothy. 74 years old, A1C was 8.6. She was tired all the time, couldn't find the energy to do things she used to love. We put her on the full H3 method. Morning water with salt and lemon, water before meals, sipping during her daily walks, magnesium water before bed. 3 months later, her A1C was 7.3. But more than the numbers, she told me she felt like herself again. She was gardening. She was going to her book club. She had hope. What can you expect if you try this? Week 1, you're going to pee more. That's just your body adjusting. Your morning numbers might start to even out a bit. Week 2 and 3, you should notice more stable readings throughout the day, more energy, maybe sleeping a little better. By week 4, if you've been consistent, you might see your A1C starting to trend down, and overall you just feel more solid, less like you're riding a blood sugar roller coaster. Now, I have to give you the serious warnings because this isn't right for everyone. If you have kidney disease, you cannot just start drinking a lot more water without talking to your doctor first. If you're on medications for blood pressure or heart failure, same thing. Check with your physician. And obviously, if this starts working and your blood sugar drops significantly, you might need to adjust your medications. That's a good problem to have, but it needs to happen under medical supervision. You could go too low, and that's dangerous. This method is supportive. It's an adjunct. It helps your body use insulin better. It helps your medications work more efficiently. But it's not magic, and it's not a cure. It's just getting back to basics in a smarter, more strategic way. I want to challenge you to try this for 14 days, 2 weeks. Keep a log. Write down your numbers. Write down how you feel. Notice what changes. And then share it. Tell your doctor what you're noticing. Tell other people in your life who might be struggling with the same things. This kind of practical, accessible information can change lives, but only if people know about it. We spend so much time making diabetes management complicated. Sometimes the most powerful interventions are the simplest ones. Water, salt, timing, consistency. Give your body what it needs, when it needs it, and watch what happens. So here's your quick reference to take with you. Morning, 12 ounces of warm water with a pinch of sea salt and lemon. This cuts down that morning glucose surge and primes your whole hydration system for the day. 15 minutes before meals, 6 to 8 ounces of water. This slows down how fast carbs hit your bloodstream and steadies your post-meal numbers. During activity, 4 ounces every 15 minutes. This keeps your blood volume stable and stops those glucose swings. And at night, warm water with magnesium, better sleep, steadier overnight glucose. That's it. That's the H3 method. Simple enough to start today, powerful enough to change your numbers and how you feel. I hope this helps you. I hope it gives you one more tool in your toolbox, one more reason to believe that you can get a handle on this. Because you can. And sometimes, it starts with something as basic as a glass of water. Dr. Sarah Wilson,